think about healthcare, you might first think about the expensive acute care that we read about in the headlines. But if you ask family physicians, they'll tell you that 90% of your healthcare is in the community. But really, who provides almost all of your healthcare? It's not doctors, it's not nurses or other healthcare providers like me. It's you. Real healthcare is self-care. The best predictor of your future health are the habits you practice today. So the 4 foundations of good self-care are what you eat, what you do, how you feel, and how you relate. What do you put into your body, both healthy and unhealthy things? What do you do with your body? Physical activity that supports all the activities of daily living and helps you do what's meaningful for you. How do you relate to other people? How do you connect at home, work, and school, and with society? And finally, how do you feel? How do you recognize your emotions and how do you manage them? And how do you live a meaningful life? The doctors who compose the divisions of family practice care for our patients in our practices, care for you individually, but now care for our community as a whole. And we're involved in other stakeholders in providing the best healthcare that you can have and to make you the best self-care provider. Let's talk about important neurological symptoms. So that includes the spinal cord, the nerves, the sense organs, and the brain. The first question, are you having headaches? So there are very few people that have never had headaches, but as an adult, we should know whether or not there's been a change in your pattern of headaches and the change in the nature of your headaches. So I have migraine headaches, so I have a particular pattern with the headaches that I know if I follow a usual regime, waking up at the same time, eating a healthy diet, getting enough rest, that I don't need to take any medication for pain or for prevention. So migraines are very specific headaches that are usually one side of the head, but not always. Usually severe and throbbing, usually lasting 4 hours or more, sometimes associated with nausea without necessarily throwing up, and it could be associated with sensitivity to light or to smell. So those are the classical symptoms of migraines, and there's particular triggers. Often they're hereditary. But if someone with a migraine has the worst headache they've ever had, and there's neurological features that are different from what they normally have, then we usually investigate and probe a little bit deeper. So a change in your headaches makes a big difference. A lot of us have tension headaches. So if you had a hard day, some stress, get dehydrated, you might have the usual muscle tension type headache, which is not as severe as a migraine and is often relieved by over-the-counter medication or a nice massage. And then there's the sinus headaches you might get with allergies or with infection, usually found in the front of the head, around the nose, usually associated with nasal congestion. But there are some more serious headaches that some people might present. So escalating headaches, headaches that are progressively getting worse, or headaches that are associated with progressive neurological symptoms like progressive drowsiness or sleepiness. That could be due to something more serious like raised pressure in your brain. That could be due to something called hydrocephalus, or from a tumor, or from a stroke. So if anyone you know has complaining of a headache and it's not like their usual headache, getting worse and worse, or other symptoms associated with, including decreased level of consciousness like drowsiness, then they should be taken to emergency. Pretty well any progressive symptoms with any changes in your behavior or any function of your body requires prompt medical attention. So a common question we'll ask is, do you have tremors? And if you don't, you might not know what a tremor is. So a tremor is a rhythmic movement like a shaking of the hand, or bigger movements that some people have with Parkinson's disease. So there's one called a familial resting tremor we commonly see as people get older, and there's usually a family history of it. And typically with a familial tremor, it's relieved by having a glass of wine or other alcohol. So we don't prescribe that as the cure, we just use that for the history. So if you do have a resting tremor, don't try to cure it yourself with alcohol. Maybe have one drink to test and then see your doctor. Now I think everyone here, including myself, has had dizziness in the past, but we do ask about dizziness. And when people say they're dizzy, they often mean at least one of two things. Often it's lightheadedness, so that's the feeling that when you stand up quickly you feel like you might faint. And the other is vertigo, that sensation of being on a merry-go-round where you feel your sense of balance is exaggerated. So the first one, lightheadedness, could be due to anemia, where your red blood cells are very low. It could be due to low blood pressure or blood sugars being low as well. And then the other type of dizziness, vertigo, that exaggerated sense of movement, has many causes. It could be due to an inner ear disorder. It's common after some viruses. Usually it might be bad for a day or so and then progressively get better. But if it's persistent or getting worse or just not getting better, out of the ordinary, you should get it checked out. Most of the time it's fine, but you shouldn't delay if it's been a change for you. It could also be due to injuries or problems with the brain. So there's a portion called the cerebellum that controls our balance. So we want to make sure it's not a central cause rather than a peripheral cause, like the inner ear. So again, persistent vertigo or vertigo associated with other neurological symptoms needs to be looked at further. So do you have numbness or altered sensations? So this could be due to a nerve being compressed, like carpal tunnel syndrome, where your 3 middle fingers on the palm side fall asleep or feel tingly, often in the morning or after doing a lot of work with your hands. So that's a common symptom with carpal tunnel syndrome, where the median nerve is compressed just at the wrist. Another form of nerve compression would be sciatica, where you might have a bulging disc pushing on the sciatic nerve that goes down your leg. There's other symptoms that can mimic that, so always check with your doctor if you're having nerve-type symptoms. And then there are some conditions that involve the brain, like a stroke can cause numbness or weakness on one side of the body. It could also cause, also a tumor can cause the same symptoms on a more gradual basis, and multiple sclerosis can cause sporadic numbness or tingling or odd sensations. It doesn't mean any numbness or altered sensations is something bad, but you should check it out with your doctor if it's something that's persistent and hasn't disappeared in a short while. And then finally, have you had memory problems? So the first thing people think about is, are they losing their mind? Is it aging? Is it dementia? I try not to blame most things on aging. So when people complain about not being able to read, I don't tell them that their eyes are aging, although we call it presbyopia. I just tell them that their arms are no longer growing, so they can't hold the newspaper far enough away. Or if they point to a part of their body and ask, is this aging? No, I say it's not due to aging, it's due to gravity. And they're pointing to spots on their skin. Is this an age spot? Then we tell them it's a sunspot. But some memory problems could be due to attention deficit disorder. So we're finding more adults are showing the symptoms of attention deficit disorder. But actually, they've shown them all their life. They had difficulty focusing, but just recognizing it now. So that could be a reason why your husband forgets to pick up his stuff and to clean up after himself. It could be also other things affecting the brain. It could be due to stress, and it could be due to dementia. So always check it out if there's a progressive change in your memory. So normal aging, we might be a little bit absent-minded, might forget what we had for breakfast. But if we forget the day of the week or the month of the season, that's a significant change. If you forgot where you parked your car at Metrotown, that would be okay. But if you're looking for your car for an hour in Metrotown parking lot and you took the bus and you haven't driven for 2 years, that's really serious. If you forgot where you put the cheese, that's okay. But if you find the cheese in the laundry machine, that's abnormal. And forgetting how to do something that you used to do before, that's significant too. So see your doctor if you're concerned. But I find that most people that are concerned about their memory are actually totally fine. It's when their family complains about their memory and they think nothing is wrong except for the person that's stealing their stuff and then returning it and putting it in a different place. So most people with significant problems don't always recognize it. So 2 neurological emergencies would be a seizure. So if you've never seen someone with a seizure and see it for the first time, it's really scary, but it's when someone loses consciousness and usually associated with abnormal involuntary movements. So not just a tremor, but the whole body shaking is a common type of seizure. There's one seizure that a lot of little children might have called absent seizure. So they don't shake, but they're just talking and then they have a blank look for a minute or so and then they resume talking again as if nothing happened. So those are absent seizures that don't have the abnormal movements. But most seizures have that involuntary movement at the same time. So if you haven't dealt with a seizure, someone's had a seizure the first time, then you do call 911, get it attended to right away. And of course, the other emergency is stroke. So a stroke, then the symptoms can be a sudden appearance of neurological symptoms like numbness, tingling, weakness, difficulty speaking, loss of vision, loss of your hearing, or strange behavioral changes that are sudden in onset and then progressive. So don't wait till it gets better. We want you to call 911. And faster to call 911 rather than to try to drive to the hospital yourself.